Hi everybody, this video of mine is about lipoma, which is a slow growing fatty lump that is most often situated between your skin and the underlying muscle layer. A lipoma which feels doughy and usually is not tender moves readily with slight finger pressure. Lipomas are usually detected in middle age. Some people have more than one lipoma. A lipoma is not cancer and usually is harmless. Treatment generally is not necessary, but if the lipoma bothers you, is painful or is growing, you may want to have it removed. Now let me tell you the symptoms of lipoma. Lipomas can occur anywhere in the body. They are typically situated just under the skin. They commonly occur in the neck, shoulders, back, abdomen, arms and thighs. They are soft and doughy to the touch. They also move easily with slight finger pressure. They are generally small. They are typically less than 2 inches, that is 5 cm in diameter, but they can grow. Sometimes painful. These lipomas can be painful if they grow and press on nearby nerves or if they contain many blood vessels. You should see a doctor if a lipoma is. You should see a doctor if there are some associated symptoms. If you notice a lump or swelling anywhere in your body, it is better to be checked by doctors so that a clear-cut diagnosis of lipoma is made in order to avoid any other problem. For example, it could be some other lump which should be diagnosed as soon as possible. Now coming to the causes. The cause of lipomas is not fully understood. They tend to run in families, so genetic factors likely play a role in their development. Now I'll tell you the risk factors. There are several risk factors which may increase your risk of developing a lipoma. That include if you are between 40 and 60 years old. Although lipomas can occur at any age, but they are most common in this age group. Also, as I told you before, lipomas tend to run in families. Now coming to the diagnosis and treatment. Diagnosis of the lipoma is very easy because usually once a patient comes to us, we do a physical exam and we can easily feel the lipomas. Also, sometimes a tissue sample we can send for a lab examination, that is known as biopsy. And sometimes we take an X-ray or other imaging such as MRI, CT scan. For example, if lipoma is large, it has unusual features or appears to be deeper than the fatty. There is a very small chance that a lump resembling a lipoma may actually be a form of cancer called liposarcoma. These liposarcomas are cancerous tumors in fatty tissues, but they grow rapidly and they do not move under the skin and are usually painful. So this is the big differentiating point. A biopsy or an MRI or CT scan is typically done if we suspect there is a chance of liposarcoma. Now coming to the treatment. No treatment is usually necessary for a lipoma. However, if the lipoma bothers you, is painful or is growing, we may recommend that it should be removed. Lipoma treatment includes surgical removal. Most lipomas are removed surgically by cutting them out. Recurrences after removal are uncommon. Possible side effects are scarring and bruising. A technique known as minimal excision extraction may result in less scarring. Then there is another option that is known as liposuction. This treatment uses a needle and a large syringe to remove the fatty lump. I hope you like this informative video about lipomas. As I mentioned previously, they are usually very, very benign. They are harmless. But it's better to be seen by the doctor so that he or she can identify is there any risk of like liposarcoma, as I just mentioned. But usually they are very benign, and if you leave it there even for years, nothing will happen. If you want to comment on my video, or if you have any problem, it's not just lipoma, but if you are suffering from any other illness, please comment and I'll try to reply you as soon as possible, and I'll try to make a video on your illness. And if you have not subscribed my channel till now, please subscribe it, and I hope you will get some sort of benefit from my videos. And if you think that there is some even 5 to 10% of benefit to you, please like this video and share with your friends and families and through social media. Thank you very much. See you in next video. Bye.